Hello and welcome to Conversations with Disability Rights North Carolina. I'm Tori Ekstrand, an associate professor at the UNC Hussman School of Journalism and Media, and I'm happy to be joined today by Corye Dunn, Director of Public Policy for DRNC. The COVID-19 pandemic has changed a lot about disability advocacy, and today we're going to focus on how institutions within the state have been affected and learn a bit more about the work Corye and her colleagues are doing currently to help those with the virus. So Corye, thanks for being here. Can you tell us a little bit about the work you do in general? What does a director of public policy do for an organization like DRNC?
Sure. Thanks, Tori. I work to ensure that the rights of our clients are respected in all kinds of public policy making. Sounds really broad, but the lives of our clients are really broad. So we work across the lifespan and across disability. So whether your disability began at birth or whether you have an acquired disability late in life or anything in between, and across settings. So we work on policy related to schools, related to healthcare, related to employment, and services for people with disabilities, and also work to eliminate discrimination against people with disabilities in terms of community access. So parks, recreation, all the way to our inmates in our state prisons being allowed reasonable accommodations to meet their needs.
Right. So with those populations and with what's going on, obviously, with the virus, can you tell us a little bit more about how that work is changing? What has the last month been like for you and your colleagues?
Sure. I have been, frankly, surprised, maybe I shouldn't have been, but surprised by the degree to which our work has had to pivot almost entirely to COVID-19 response. We have had to change our monitoring protocols. Protection and advocacy agencies have what's called access authority. We are able to monitor in any facility where a person with a disability is receiving services. And that monitoring, because of safety protocols and frankly the lack of PPE, has had to move primarily to remote monitoring. That shift was huge and required developing new models and also working with service providers and regulators to make sure everybody knew what the new rules were. So, you've heard that facilities shut down and allowed no visitors. Well, we're not visitors. We play a different role. And so we still have access, and we've had to figure out under the new rules, we've had loosening of HIPAA, for example, so we can do some video monitoring by having staff use video to show us something that's going on in a facility, for example. That's been a big change. Of course, the General Assembly has convened several committees to address changes that might need to be made in response to COVID-19. And those committees are considering draft legislation, and we're working with legislators and other stakeholders to make sure that any legislation that's passed in the short session does not either purposefully or inadvertently restrict the rights of our clients.
Right. So I know one of your focus areas obviously is on these institutions, whether we're talking about prisons or adult care homes. Can you talk a little bit about what's happening in relation either to the legislation or the work you're doing to help people, particularly with disabilities, in these institutions around the state?
Sure. We are always we always pay attention to facilities where people with disabilities receive services, and we have a particular interest in making sure that people are not being that our state is not over relying on institutional services to support people with disabilities. But in this case, we've really had to refocus on making sure that facilities are responding appropriately to this crisis. And in many cases, they were wholly unprepared. And despite, in many cases, the best of intentions, we've seen really, really troubling circumstances that have resulted in, the rapid spread of the virus through skilled nursing facilities, prisons, all the things you've seen on the news. Well, those facilities disproportionately are housing people with disabilities. So we are responding to the ways in which our clients are endangered by the conditions of the facility, including poor infection control and just structural barriers to safety. Like, if you have 3 sets of bunk beds in a prison that are no more than 4 feet up, the top and the bottom are no more than 4 feet apart, and the head and foot of each bed are basically touching or near each other. Social distancing is impossible in that setup. It's just what we know works cannot be implemented in that environment. So what do you do? So we've urged the governor and the Department of Public Safety to reduce prison populations to make distancing more possible, and to allow folks who are at particularly high risk, people with disabilities and chronic illnesses, to be released so that they can protect themselves at home.
And is that work primarily through working with the governor's office and the health department directly? Are you working with the various agencies that are running or helping to oversee these institutions? I guess I'm wondering, like, is it a rash of phone calls?
Right. What does the work look like?
Yeah. What does that look like on a daily basis? Because this is, like you said, on a daily basis in the news, we're hearing about, issues of infection at Butner, down at News. And these are where our hot spots are, right? So,
right. So we have a fantastic team of attorneys on our criminal justice team, and they have been working with coalition partners to do everything. So they issued a letter to the governor asking for a number of changes, and without an adequate response from the governor, the decision was to file a writ of mandamus, and sorry, I have to back up a little bit. So the decision was to file a writ of mandamus that was initially filed with the North Carolina Supreme Court. That writ was dismissed without prejudice, and we have, as a coalition, have refiled in Superior Court and await that court's decision.
And what will that do, that writ? What will that?
So really the purpose of that writ is to get policymakers to do what they can and what they should to create a safer environment. So do what we know works. For example, soap is not a plentiful commodity. It's not free in our prisons typically. So make hand washing more readily available. Typically hand sanitizer, because of its high alcohol content, is not permitted in our state prisons. That needs to be readily available. For circumstances where people cannot physically distance, protective equipment needs to be available. For people who are high risk of complications due to COVID-19, people with advanced diabetes or COPD or other respiratory issues, for example, and people over 65 in particular, consider release. Consider their risk inside of the prison as a factor in early release. And so those are the kinds of things those are the kinds of things we've urged our state government to do to make everyone safer. I think there's this notion that prisons are closed networks, but in fact, people go in and out of them every day. Employees go in and out every day. Inmates go in and out every day. They are transferred, they move from jails to prisons, they are released. And we're all safer if we don't create these hotbeds of infection. And certainly people with disabilities who are overrepresented in our prison population are safer if we follow these kinds of protocols. But even in skilled nursing facilities where you would expect a much higher degree of attention to infection control, we've found that not only were they unprepared for this kind of virulent spread, but that many of the places that have seen the most dramatic outbreaks have had previous citations from regulators for failure to provide appropriate infection control. And so our regulatory system hasn't gotten those folks into compliance in the past, and that's now having deadly consequences for people with disabilities in these facilities.
Is there anything that we're going to ask our legislators, or that we're asking legislators to do, since the session is coming up, right?
Absolutely. So April 28th is the beginning of the short session for 2020, and it will be a truly short session. In the beginning, at least, they will only come together for votes because they don't want to spend a lot of time in a room together breathing each other's air. They have been working in committees, COVID-19 response committees, that are considering draft legislation and polishing it up so that when they come back and are officially in session, they really only have to come in and vote to minimize infection risk. And so right now, our staff are engaging with other stakeholders. So, if when we're talking about regulations on whether you can use telemedicine for a particular kind of evaluation, for example, we're working with the facilities that would be conducting those evaluations, hospitals, acute care facilities, those kinds of things, psychiatric residential treatment facilities. And we're working with those stakeholders and also with legislators to get to the right language so that when they come in at the end of April to just vote, when there will be no changes, we have it all right.
What concerns you in the coming months? What are the things that you're thinking about coming up for the people we serve at DRNC? What is it? Yeah, what is it that is sort of next as you look ahead to, say, fall?
It's so hard to think.
Oh, right. Yeah.
It's so hard to think past next week right now.
Yeah.
And we do have some COVID emergent issues that are still not resolved, like making sure that family members can be present with their loved ones who have intellectual and other developmental disabilities or other, and people who have significant communication barriers so that they can get adequate health care when they are inpatient, whether that's for COVID-19 or any other purpose. I do think we're going to see, looking down the road a bit, I do think we're going to see some pent-up demand for healthcare. People are avoiding healthcare, especially emergency care and hospitalization, as much as they can right now. So I think that sort of suppresses the non-COVID related treatment that's being done, but that demand isn't going away. People's elective surgeries that were scheduled are not, they're not unimportant, they just weren't urgent. But as time goes on, they may become more urgent. And there are going to be folks who have held on longer than they ordinarily would have before they address a health concern. I am concerned about the increase in demand on health services when that happens. And I'm particularly concerned about our clients with behavioral health needs who are fearful to seek help because they, A, don't want to risk infection by being around other people, B, don't want to be, are concerned that their treatment will be deprioritized as a result of COVID-19, and are concerned that if in fact they do get COVID-19, that their care would be further deprioritized because they were not seen um, as worth saving. And so those dynamics are going to continue to play out for months in our system, if not years. So we'll still be struggling with that months from now. I can imagine that there are people sitting at home right now who would, based on the way they feel today, would ordinarily seek emergent or urgent care, who have decided to hang on longer and who may not get better. And that's probably true for both physical and behavioral health care needs, but we are certainly hearing about folks who are holding on much longer than they ordinarily would for, they're experiencing significant mental illness, they are experiencing substance use disorder related needs, they are experiencing all this change, their 11-year-old with autism is experiencing significant behavioral changes that are concerning. And so, we're all doing the best we can, and those folks are holding on with their fingernails in a lot of cases.
Yeah, there'll be this sort of flood of needs above and beyond what will be needed to help keep combating the virus over the
Right.
coming months. Yeah.
Right. And I'm concerned that those needs will be more acute than they would have been ordinarily because we all are holding on as long as we can.
Right. Right. What is it that people can do generally, those of us who are advocates for people with disabilities themselves? What is DRNC saying about people who need help in this moment? What can folks do now if they need help or they want to help?
I'm so glad you asked. There are a lot of ways you can help. The first is if you have a story, if you have experiences related to your disability and COVID, or your non-COVID related needs that might be affected by the changes in the healthcare system related to COVID, please tell your story. Tell us your story. Tell your family your story. In some cases, it will be helpful to tell policymakers or media your story. But we don't know what we don't know, and it's only because the media has told stories that people know that prisons are particularly dangerous places during a pandemic, that psychiatric hospitals are not prepared for this sort of infection control, that that our nursing homes are incredibly dangerous places to be when there is a virus that's very difficult to control. So tell your story. And if you're looking for a place to tell your story, we have some opportunities on our website, and check out our Facebook. We're at disabilityrightsnc.org on the web, and Disability Rights North Carolina on Facebook. There's also Twitter and Instagram, as I understand it. So tell your story, tell us what you're experiencing, talk to other people, and check on your people. Do you know people who maybe are safe from COVID-19 because they've done excellent social distancing, but are at risk of other concerns? Are they lonely? Are they food insecure? Are they going to be able to make the next housing payment? Find out what's going on in your community. And there's a ton of good work going on with mutual aid and people helping each other out. Be connected. Don't let social distancing mean that you've lost your connection with people, but also look for the people you can help, or you can at least connect with resources. There are a number of resources available for people who are struggling for any reason during this time. And so you can take a look at our website for more information. And also there are opportunities on there to learn more about what's going on in state government and in federal government, and you might want to take action on those.
Great. Corey, thank you so much. Thank you to DRNC and to all your colleagues for the work you're doing on a daily basis here to help so many people with disabilities and their families during the pandemic.
Thank you, Tori.